Did you know that approximately 7 million children were diagnosed with ADHD in 2022? ADHD, or attention deficit/hyperactivity disorder, is one of the most common neurodevelopmental conditions globally. Despite growing public awareness, misconceptions and lesser-known facts continue to surround the condition, affecting how it's understood, diagnosed, and managed. These misunderstandings often shape societal attitudes, healthcare approaches, and even the experiences of individuals living with ADHD. Today, let's dive deeper into some often overlooked aspects of ADHD to foster greater understanding and compassion. A common misconception about ADHD is that it's a disorder exclusive to young children, typically diagnosed between the ages of 3 and 7, and that most individuals outgrow it as they age. While it's true that ADHD symptoms often manifest early, research tells a different story when it comes to the disorder's progression. Approximately 60% of children diagnosed with ADHD continue to experience symptoms into adulthood. However, the way these symptoms present can change over time. For instance, while hyperactivity and impulsiveness might dominate childhood behaviors, adults with ADHD often struggle with executive function tasks, such as time management, organization, and self-regulation. One particularly challenging symptom is a distorted perception of time. Adults with ADHD may underestimate or overestimate how long it takes to complete tasks, leading to missed deadlines or feeling overwhelmed by schedules. This can ripple into various aspects of life, from work to relationships, underscoring the importance of long-term support for those with ADHD. How often do you hear people say, "That kid has so much energy, they must have ADHD"? While it's true that hyperactivity is one potential symptom, it's not the defining feature of ADHD. Many children are naturally active and energetic, and these behaviors are often mistaken for hyperactivity or inattention, especially during early childhood. This is partly why ADHD is more frequently diagnosed in boys. Boys tend to exhibit externalizing behaviors like running, jumping, or fidgeting, which are easier to observe. On the other hand, ADHD lacks a clear biological marker for diagnosis, making it subjective and susceptible to cultural or societal influences. Factors such as gender norms, biases, and even how much time a doctor spends with a patient during an evaluation can affect the accuracy of a diagnosis. For this reason, experts often recommend waiting until a child has reached developmental maturity, typically around age 7, before conducting formal ADHD assessments. ADHD is frequently associated with hyperactivity and impulsiveness, behaviors society often links to boys. However, the presentation of ADHD can differ significantly between genders, and these differences have real consequences. Girls with ADHD are more likely to exhibit inattentive symptoms such as daydreaming, forgetfulness, or trouble staying focused. These behaviors are less disruptive and thus less likely to attract attention from teachers, parents, or even healthcare providers. As a result, many girls remain undiagnosed or are misdiagnosed with conditions like anxiety or depression instead. This disparity means that girls and women with ADHD may not receive appropriate treatment or support, leading to challenges in academic, social, and professional settings. Recognizing how ADHD manifests differently across genders is critical for improving diagnostic accuracy and providing tailored care. Although attention deficit is in the name, ADHD involves much more than difficulty focusing. It's a multifaceted condition that affects several areas of daily life, stemming from deficits in executive function. Symptoms of ADHD can include impulsivity, hyperactivity, emotional dysregulation, and difficulties with planning or prioritization. In children, this may look like constant fidgeting, interrupting others, or struggling to follow instructions in school. For adults, it might appear as procrastination, forgetting appointments, or being perpetually late. Understanding ADHD as a spectrum of symptoms, not just an inability to pay attention, can help break down stigma and promote more effective management strategies. While the exact cause of ADHD isn't fully understood, research points to genetics as a significant factor. Studies of twins reveal that ADHD has a heritability rate of 78 to 88%, making it one of the most heritable psychiatric conditions. In addition to genetics, neuroimaging studies have identified differences in the brains of individuals with ADHD. These differences are particularly evident in the prefrontal cortex, which controls critical functions like attention, impulse control, and decision-making. Understanding these biological underpinnings reinforces the idea that ADHD is a neurodevelopmental condition, not simply a matter of poor behavior or lack of effort. Diagnosing ADHD can be complex because it frequently overlaps with other conditions, including anxiety, depression, learning disabilities, and conduct disorders. This comorbidity can mask ADHD symptoms or make them more challenging to identify. For example, a child with both ADHD and anxiety might struggle with focus and restlessness, but these symptoms could be attributed solely to their anxiety without considering ADHD as a factor. A comprehensive evaluation by a licensed professional is essential to address the full spectrum of challenges and provide an accurate diagnosis. Medication, particularly stimulants like methylphenidate, also known as Ritalin, or amphetamines like Adderall, is a common and effective treatment for ADHD. However, it's also one of the most debated aspects of ADHD management. Concerns about overprescription, potential misuse, and long-term side effects have fueled skepticism around stimulant medications. However, when used appropriately and in combination with behavioral therapy, lifestyle adjustments, and supportive interventions, medication can be life-changing for individuals with ADHD. It's important to remember that treatment is not one-size-fits-all. What works for one person may not work for another. ADHD is often viewed through the lens of its challenges, but it's equally important to recognize its strengths. Many individuals with ADHD are incredibly creative, energetic, and resilient. Their ability to think outside the box, adapt to change, and bring enthusiasm to their work can make them excel in dynamic environments. By focusing on these strengths and creating supportive spaces, we can help individuals with ADHD unlock their full potential. As our understanding of ADHD evolves, so do the approaches to diagnosis, treatment, and advocacy. Ongoing research is shedding light on its causes, treatment options, and long-term outcomes. Meanwhile, advocacy efforts aim to reduce stigma, increase awareness, and push for inclusive policies. Educating ourselves about ADHD and challenging misconceptions is essential to creating a more inclusive society. By fostering understanding, we can support individuals with ADHD in leading fulfilling, successful lives. Did you learn something new about ADHD today? Are there any other topics you'd like us to cover? Share your thoughts in the comments. If you found this video helpful, don't forget to hit the thumbs up button and subscribe to Psych Insight for more content like this. Thanks for watching, and we'll see you next time.